Hi, everyone. I'm Dr. Sankita Sahi, and welcome. Today, we're deep diving into PCOS, Polycystic Ovarian Syndrome. It's the most common endocrine disorder in people assigned a female body at birth, and it affects up to 1 in 10. But PCOS is more than just a medical diagnosis. It's a condition with profound sociological and psychological implications. And over the next few minutes, we're going to explore both. Medically, polycystic ovarian syndrome it's complex. It's primarily characterized by a triage of symptoms, though you don't need all three for a diagnosis. We call these the Rotterdam criteria. The first is oligo or anovulation, meaning infrequent or absent periods, which can lead to infertility. The second is hyperandrogenism, which are high levels of male hormones like testosterone. And this causes symptoms such as hirsutism, which is excessive body hair, and acne. The third is obviously polycystic ovaries, which are visible on ultrasound and are actually seen as small follicles that haven't matured into eggs. The root cause of polycystic ovarian syndrome is still debatable, but it definitely involves a complex interplay of genetics and insulin resistance, which triggers the body to produce more androgens. Particularly, polycystic ovarian syndrome dramatically increases the long-term risk of type 2 diabetes, of cardiovascular disease, and of an endometrial cancer. What about the psychological layer? Well, medicine is increasingly recognizing that chronic stress and trauma aren't just consequences of polycystic ovarian syndrome, but they can actually be catalysts for it. And high levels of chronic stress, anxiety, or unmanaged emotional blockages directly disrupt the hypothalamic pituitary axis, which is the body's stress regulator. This causes an over-release of cortisol, which can worsen insulin resistance and stimulate the production of excess androgens we've just mentioned. So basically, it's a vicious cycle where emotional health directly impacts physical hormones. Included in this, obviously, is early life trauma, such as emotional abuse, which has been specifically linked to a higher prevalence of polycystic ovarian syndrome, suggesting that these emotional blockages can predispose the body to the condition. So now let's talk about how polycystic ovarian syndrome impacts life beyond the doctor's office, beyond the clinic, beyond the hospital. Sociologically, the symptoms of polycystic ovarian syndrome, like weight gain, facial hair, and acne, directly clash with narrow societal standards of femininity. Now, this often leads to significant stigma and mental health issues, including higher rates of anxiety, depression, and body dysmorphia. So the most recognized symptom is infertility. And in many cultures, a person's worth is tied up with their ability to bear children, making this a diagnosis a source of intense social pressure and grief. Finally, we need to address the issue of medical bias, because symptoms like weight gain are often blamed on lifestyle choices. Patients, especially those of different racial backgrounds, have often been dismissed or misdiagnosed for years. And this is a clear failing of our healthcare system, where the patient's lived experience is deprioritized. On top of the physical and internal emotional struggle, the visible symptoms of weight gain, facial hair, persistent acne clash violently with restrictive standards of femininity. And this obviously leads to severe stigma and mental health issues. And Again, a medical bias has been set up, impacting self-worth in many communities. The failure to validate the patient's lived experience is a major sociological failing in our healthcare system. So in summary, polycystic ovarian syndrome, it isn't a simple reproductive disorder. It's a condition where the body, mind, and society are inextricably linked. And true healing requires not just medication, but empathy, stress management, and destigmatization. We need comprehensive care that treats the whole person. If this information has resonated with you, please contact me directly, Dr. Sangeeta Sahi, at my website, www.genuinehumanbeing.com. That is www.genuinehumanbeing.com, or look me up under Dr. Sangeeta Sahi, where you can subscribe to more holistic health discussions, and do share your experiences and comments. So let's advocate for better healthcare together, and let's keep this conversation going. Thank you.